Good morning, friends. Good afternoon, good evening, depending upon where you are. Welcome to CNS Viewpoint. Today, we are going to talk about another important fact we read, and that was about that not only vaccine rollout was inequitable against COVID-19 worldwide, but also the access to testing for COVID-19 has been very, very inequitable. I was so shocked to read that low-income countries were rolling out 100 times less tests than rich income nations, and middle income nations had rolled out about 10% of the tests, 10 times less tests than the rich income nations. So if you look at the testing, COVID-19 testing done in the rich income nations, it was 10 times more than middle income nations and 100 times more than low income nations. It is, of course, it's very evident, the more you test, the more you know, the more people will know of their status, whether they are negative or positive. Coronavirus being an infectious disease, Omicron, which is astonishingly infectious, and it has spread to so many countries in the worldwide, and maximum number of new cases in 24 hours are reported when Omicron hit the planet, or different waves in different countries, different peaks in different countries, not at the same time, but still in 24 hours the world was reporting the highest ever number of new corona cases. So coming back to the tests, so it is important for access to tests to be equitable, so that whether a person is in rich nations or old nations, because everyone got infected, or a lot of people everywhere, people got infected. In every country, people got infected with coronavirus. Even Antarctica reported cases of coronavirus. Even Mount Everest had reports of cases of coronavirus. More than 400 species of animals have reported coronavirus. So COVID-19 is such an infectious disease. Testing has to be made available in a much more equitable manner. This kind of inequity, where rich nations have testing 100 times more than the poor ones and 10 times more than the middle income nations, this is not acceptable. This is not doable. This is another point where inequity puts us to shame as a humanity. If there is one thing which coronavirus pandemic has exposed, it is inequity at every level. If you look at the sustainable development indices, or if you use the development lens, and the inequity is not new. It was already there when the coronavirus pandemic took us, literally caught us with our pants down, but if there is one thing governments can start doing better, it is about inching or radically revamping their responses so that they are more equitable for the and not the gap between rich and poor does not exist like this, that there is a whole different level of quality of life for high income people and low income people, even within the same nations. So for example, although rich nations had vaccinated most of their population, but even if a small number of population was left unvaccinated in rich nations, you will see during Omicron wave, it was more than 90% of the people who were hospitalized due to COVID-19 in rich nations were unvaccinated. So it was again, the people who were privileged and who had access to vaccination, over 90, like a huge amount of number, 90%, 80%, 70% of the population was fully vaccinated. They had even received boosters. But the people who were left behind, even in the richest of the rich nations, they were still at a very heightened risk of COVID-19. And of course, people in the middle and low income countries with much lower vaccination rate, they were definitely much more at risk. No doubt about that. So let us hope that the inequity is addressed more effectively, and not just in vaccination, but also in testing, in healthcare services, in every possible dimension or spectrum of development. The governments need to walk the talk on their oft-quoted mantra of no one left behind. I don't think many countries have done even were to any extent that can be taken as acceptable on leaving no one behind. So with this hope, I will end today's CNS Viewpoint, and tomorrow again at 5 p.m. India time, we will be back again with our views and thoughts and perspectives on something that made us think. Thanks a lot for joining us, and stay tuned tomorrow again 5 p.m. India time. Bye bye till then.